Families with aging parents often have to make important decisions for them while respecting their autonomy. That's why forms of guardianship can be critical in getting health care and social services. But there's less access for others without those family connections. That's one of the reasons for a presentation about the need for guardianship reform scheduled for tomorrow at Ethos in Jamaica Plain. To explain the issue are two guests from the Guardian Community Trust, the Director of Research, Heather Connors, and Education and Training Specialist, Traci Cucinotta. Thank you both very much for being with us.
Thank you.
Thank you.
I want to start with Traci. When I say guardianship, I was using the catch-all term here. What does it mean exactly?
Well, guardianship is when a court appoints an individual, an institution, or an agency to manage the affairs or to make decisions for an individual who is 18 or older, whose decisional-making process is impaired. These impairments can be related to aging issues, to developmental issues, or also to mental health issues as well.
And coming back here to Heather, as far as why this is so important for getting services, I mean, if it's a family member, you know, this is pretty plain, but for people who are not in the family, how much of a difference can this make?
It can make a huge difference. We have people who are unable to consent to medical care. We have people who are unable to manage their financial issues because there's really nobody available or willing to make those decisions for them. If the person lacks capacity and has no decision maker available, they're really put in a very difficult and very, very vulnerable position. So we need people available to become guardians. And right now in Massachusetts, there's a terrible lack of people available to make those decisions.
Where are these people encountered usually?
We see them in the nursing homes, we see them in hospitals. So in hospitals, we may have a person who is admitted to the hospital, has a very long length of stay as a result of the hospital not being able to find a decision maker available or willing to step in to make those decisions. And we have people who sometimes wait weeks, even months in the hospital before discharge, before a decision maker is identified.
Traci, I mean, I imagine that if this is a person who needs that kind of help, you know, once you get out of the hospital, for example, you might need somebody to do follow-ups, make medical appointments, take them around. I mean, there's just a huge number of things here, right?
Right, it is. Yeah, I mean, you know, once they're out of the hospital, there's all kinds of issues that need to be dealt with. As you said, medical appointments, maybe housing, maybe bill paying, all types of issues that fall into that.
And really, in the best case scenario, we're trying to identify the needs and wishes of the person who's under guardianship. So being able to let that person make as many of the decisions as possible, or at least involve that person in those decisions, is really the very best case scenario.
So Traci, what can be done for people who don't have those family members at their disposal?
Well, what can be done is if a guardian is appointed for them, then a guardian is the one who can step in and make those decisions for them. In addition, we also believe in supported decision making, possibly having people around them who they know or they trust who can help them in the decision making process with the things that they are also looking at.
Coming back to Heather, it seems for this you need two things. You need some kind of a legal framework, and maybe you need some resources to make this work too, right?
Absolutely. So right now in Massachusetts, there are, like I said, not enough guardians available. We do have a court system that identifies people as in need of a guardian. Somebody will come into court and say, here, we need a guardian, but we don't have anybody available. Is there somebody that you can appoint? And sometimes it takes weeks and even months for the court to find somebody who's able to do that, take on that position. So we're hoping that a public guardianship system can be put in place in Massachusetts to really take on that safeguard role, that safety net role, to pick up the slack for those that don't have it. A 2016 study estimated that between 3,800 and 4,800 people could use a public guardian in Massachusetts, but were unable to access that.
Traci, you've been trying to spread this message around the state in a series of events, including the one happening tomorrow. What's it been like so far?
So it's been really good. The turnout has been great. People have been very receptive, very engaged. They want to know more. They're surprised at some of the things that they're learning. We're trying to help educate them on resources and tools that are available in the community so that they can continue to care for individuals in the community. So we're talking about guardianship, but we're also talking about alternatives to guardianship as well. So they're learning a lot of things that they maybe didn't know, even though this is the cohort of people that they work with.
What about those alternatives? What could that mean exactly?
So some alternatives could be a healthcare proxy, simply just designating a healthcare proxy, someone who could make medical decisions for you. Other alternatives could be a power of attorney, having that put in place. Could be maybe having a representative payee to help with financial issues in bill paying, maybe case management services. And again, people surrounding them to support them in their decisions that they're making, to give them some advice for the decisions.
We're talking with Heather Connors and Traci Cucinotta from the Guardian Community Trust. Heather, those alternative, more limited forms of guardianship that Traci just mentioned, it still strikes me that you need someone to vet those people too, don't you?
Yes, and that's really what we're hoping to do. Right now, those alternatives don't really have a lot of oversight over them. But we saw in a study, an article in the New Yorker in October, that there is abuse of guardians, abuse by guardians. And one of the things that we're suggesting for the public is that we have a oversight and monitoring office for the public guardian. We really believe that there needs to be some main oversight office that can make sure that the guardians are doing the right thing and that they're making sure that they're fulfilling the promises that they're making and that we as a public are making to the clients that we're really responsible for, these very, very vulnerable people.
Thank you both very much, Traci Cucinotta and Heather Connors. In a moment, a sneaker drive in the spirit of One Boston Day.